Hi, Sarah. Thank you for joining us today on this webinar series. So why don't you go ahead and just introduce yourself and tell us a little bit about yourself.
Yeah, absolutely. I'm happy to be here.
Mm-hmm.
So my name is Sara. I am a second-year Ph.D. student in the Department of Epidemiology at the University of Florida.
Mm-hmm.
I am a psychiatric epidemiologist, so most of my work revolves around psychiatric disorders like anxiety and eating disorders and
Oh,
obsessive
wow.
compulsive disorders. So a lot of variety there. I also dabble a little bit in substance use. So right now I'm working with doctors Catherine Striley and Carol Matthews,
Mm-hmm.
who reside in both epidemiology and psychiatry.
Wow.
So in terms of my current role in the COVID-19 response, essentially the Department of Health for the state of Florida reached out to, I think, about 6 schools throughout the state,
Mm-hmm.
and was interested in hiring trained epidemiologists to
Mm-hmm.
help with some of the contact tracing that's, of course, much needed to stop the spread of the pandemic as quickly as possible. So at the beginning of April, I was deployed to Sumter County.
Ah,
Um,
that
yeah,
was going to be my follow-up question. Where are you right now?
yes. So actually, I am working from home.
Okay.
We started our deployment in Sumter County, but of course, we're advocating for everyone to be in their homes. So
Mm-hmm.
we're trying to follow those policies as much as possible.
Gotcha.
Um, so yeah, so in Sumter County, it's an interesting place to be. It's a quieter
Are you
community.
from Sumter County?
No, so I'm
Okay.
from Gainesville,
Okay.
Alachua County. So yeah, no experience with Sumter County, but of course, we know that the median age in Sumter County is much higher compared to the rest of the state. So it's a very interesting place to be in terms of dynamics
Mm-hmm.
for the development of COVID-19.
Gotcha.
But yes, being there, essentially what we do is we assist with contact tracing, reaching out to individuals who may have been exposed, as well as those who did test positive, and getting more information about places that they may have been while they were symptomatic, and really trying to do some investigative work behind the disease to figure out exactly where
Mm-hmm.
we can stop that line of spread.
I see. I was just looking on the map here. So Sumter County, for those of us who are less familiar with Florida geography, looks like it's about halfway between Gainesville and Orlando.
Mhm.
Right. So you said you were deployed. So are you in Gainesville right now?
Yes, so I went
Okay.
back to Gainesville about 2 weeks ago.
Gotcha. Okay. So how long were you in the field, so to speak, in Sumter County?
Yeah, so we were in the office for about 2 weeks.
Okay.
A lot of what we were doing was over the phone, so we realized quickly that that would be very adaptable to do within
Mm-hmm.
our homes and still be able to
Right.
help one another in a space that's less susceptible to that transmission for ourselves.
Sure. Yeah. I spoke with one of the other students in epidemiology, Alyssa, on Friday, and she's in Miami-Dade, Florida.
Yes.
So she is in the field in that office. So what have been the unique challenges that you've kind of faced just in the first couple weeks here of contact tracing?
Yeah, I think it's kind of evolved over time in terms of the challenges that we've had. In the beginning, of course, as the pandemic is new, you see a lot of misunderstanding, a lot of fear or doubt in terms of what the pandemic can bring to the community.
Mm-hmm.
And I think relaying some of that information and really being up to date with the most current recommendations was
Mm-hmm.
really difficult in the beginning because, of course, we're learning so much on our end that it can be difficult to relay the proper information to people.
Right.
And of course, just kind of helping relieve that anxiety of community members who may have been
Mm-hmm.
exposed, and really just giving them options in terms of what they can do to protect themselves and protect those around them.
Mm-hmm.
Over time, I think more of the challenges have become more of the investigative work.
Sure.
So when we have an outbreak, it's more now digging in and trying to figure out exactly what that first point of contact was,
Mm-hmm.
and really diving into where that network bloomed from there.
Sure. Yeah. So I think every individual's involvement in some part of this COVID pandemic is very unique, and I think your experience and background in psychiatry offers
Mhm.
a unique perspective too. So, what have you been able to see kind of through the psychiatry lens that maybe other students or professionals in the field aren't noticing?
Yeah, I mean, of course, we don't really talk about the psychiatric ramifications of this type of crisis as often as we
Mm-hmm.
should. So, I mean, individuals all over, both essential workers, those working from home, and those who either may have been laid off from work or are just going through really difficult changes in their life right now,
Mm-hmm.
maybe dealing with some symptoms that they really haven't experienced before.
Sure.
And at this time, it's also more difficult to get treatment because a lot
Right.
of facilities are closed, doing online communication.
Mm-hmm.
So I think it's a really difficult road to walk in terms of trying to balance these new feelings, determining whether these symptoms are normal
Mm-hmm.
or maybe a little bit outside of the norm and something that we should seek help for, and
Right.
really trying to figure out what those options for help are at a time like this.
Mm-hmm.
I think it's completely normal to be a little anxious about the crisis, but once that
Oh,
starts
sure.
influencing how your quality of life and how you're able to live day to day, I think that's really the time that we need to
Mm-hmm.
reevaluate our needs and determine whether we need some help following what's to come.
Yeah, I think when it comes to your role as a student and then
Mhm.
your role as a contact trace professional. Now, is this a paid position, or are you accruing course credits through this arrangement?
It is a paid position.
This one's paid. Okay.
Yeah.
I'm learning that not every contact
Yeah.
tracing um, opportunities are paid.
Yeah.
So when you're on the phone, you have a task. You need to, you know, find the recent contacts with somebody who's tested positive. But at the same time, what I think is unique for yourself is that you're also wearing your psychiatry student hat. So I
Mhm.
imagine you'll be learning about potential problems and anxiety people may be going through. But it doesn't sound like, I mean, you're not in the position to refer or to comment on any possible um, psychiatric issues. Am I correct?
Yeah, that's correct. I try to help relieve some of the anxieties by referring people to the most recent news and
Sure. Yep.
updates, and of course,
Mm-hmm.
what we're learning every day from most recent studies. Because I do think that learning about the virus and really getting a clear understanding of what's going on does help relieve some of that anxiety.
Mm-hmm.
But in terms of referring individuals to treatment, no, that's
Sure.
not really my place.
Yeah, it definitely, we're always juggling dual or triple roles, when it
Mhm.
comes to, we're all members of the community, we're
Right.
students, right? We're faculty, we're staff, we're PhD students, and then we have our subject matter expertise. So,
Right.
you have a unique combination of epidemiology and psychiatry. So that's
Right.
it's right. We learn in the classroom that we have potential ethical issues that may pop up, and we're learning
Right.
them, firsthand here. So I think that's
Right.
um, it's a unique learning opportunity for all of us. So,
Yeah, I
um,
agree.
is there, being on the, helping develop wellness resources for public health, and we'll see, there'll be a meditation app, or there's a resource that the state of Florida or another state, depending on where how well your state covers mental health. We'll
Mhm.
see resources there. Is there maybe like a hierarchy of um, you know most useful anxiety tools? So like the last resource would be referral to somebody, um, to a mental health professional. Are there
Yeah.
levels here of effectiveness, or where should
Um,
people turn to? Do you have any insight on that?
so I think to some degree, yes, but in the same token, it kind of differs for every person. What works for
Mm-hmm.
me may not necessarily work for you.
Right.
And our anxieties may be rooted in different places, which
Sure.
then determines how we can seek treatment.
Mm-hmm.
I think a lot of the tools that are out there through like the internet and our phones are really helping kind of bring psychiatric help to a more diverse population, and it's just more accessible to all. So I do really recommend a lot of the new apps that are coming out in terms of, like, I think journaling is a great technique to really just be in tune with the way that you're feeling. I think meditation, some people do great with exercise, really just trying to stick to how you normally deal with your everyday stresses, but then really diving into those different avenues, if that makes sense.
Yeah, definitely. So you were working in the field then field in a remote location, but through telehealth on the telephone for 2 weeks, and then you've been now in a Gainesville office or on campus doing the same work?
Home office.
Home office. Okay.
Yes.
So, has there been anything different that you've learned about kind of working in 2 locations now?
Not so much. Again, the internet and the capabilities now make it so easy to connect remotely.
Right.
That there's almost really no difference, because if I have a question, I'm able to reach out to my fellow epidemiologist relatively quickly to get some help there.
Yeah. So is your plan to continue with the contact tracing over the summer or just towards the end of the semester here?
I'm not entirely sure. I really like what I'm doing, but again, it kind of depends on the needs of Sumter County. So I'd love to stay where I am. I think that the people that I'm working with make a great team, and they're really great to work with. I really like the relationships that I've developed within the community. So I'd really like to continue working where I am. But if we do see this curve start to go down and stay down, hopefully, then there's the potential that they may not need the extra help anymore.
All right. And I imagine, so I didn't ask this to the previous students on contact tracing, but you always have like a need of contact tracers, if that would be the term, regardless if the positive testing goes down, or maybe I answered my own question there, but what will be the supply and demand, so to speak, of the work that you're doing?
Yeah, I think in terms of optimizing our control over the virus, more contact tracers would be, of course, better at all times. It really just depends on how well the community is doing with social distancing, how well our measures have been put in place already, where we've limited transmission up to this point. I think as we do start reopening communities and trying to return back to what we consider our normal way of life, that's going to become an increased demand, because of course we're going to have that social distancing will start to go down. Transmission will heighten a little bit as we start to transition out of this confined time. And as that happens, we do need to be aware of all the people that we're in contact with. So
do you ever get the questions on the phone when you're speaking with folks of, when do you think the social distancing rules will be over?
Every day.
Every day, right.
Every day. And it's a question that I'd love to know the answer to.
Right. And we all say, well, let's just turn to what Dr. Fauci is recommending, trickle down to the governors and go from there.
Right.
So you've been, in this work now for a good 4 weeks. So what's the kind of the one thing that you learned that maybe surprised you, that you hadn't anticipated learning, when you first started, as a contact tracer?
That's a great question. I think in general, one of the big things that I've learned during this time that isn't really highlighted by the media, and that I don't think everyone really is able to see right now, is just how willing the community is to step up during this time and really help make the effort easier for all of us who are working on the front lines.
Right.
So by that, I mean, when I'm talking to people, I've had people pull out their phone book and give me the numbers of each person that they think, like, people are just very willing to go the extra mile
that's great.
to help protect their friends and family. And yeah, I think that's something that I wasn't quite expecting. I was expecting a little bit more hesitation from community members.
Mm-hmm.
Um, because of course, like we've been discussing, everybody's just really anxious right now. So it's a hard thing to put so much trust in
Right.
somebody else. But everyone's been super great in terms of just really providing whatever I ask for and
Mm-hmm.
more, and to be able to help.
Yeah, that's great to hear. That's Alyssa mentioned the same thing for the folks that she's been contacting
Yeah,
in Miami-Dade down on South Florida. So it's reassuring to hear that maybe this is this is a statewide community,
yeah,
sense of community. So that's great.
yeah.
Um, if we connect this to again to wellness and mental health and well-being, what would you say? What would be some insights as it relates to like your own health and well-being through this process? Like what have been, have there been any significant challenges? I imagine moving for 2 weeks and moving back had been a challenge, moving down to Sumter County. But if you want to kind of share any thoughts or comments on your own kind of health and wellness journey through this type of work.
Yeah. Kind of balancing everything that's come up over the last few weeks
Mm-hmm.
has, of course, been a challenge, but I think it's also been really rewarding in a sense where I've learned a lot about things that I need to work on personally.
Mm-hmm.
So, for example, I'm always been a people pleaser, but of course, balancing two jobs, there's no way that I can complete all of the
Sure.
work in the same timeline. So I think it's really kind of pushed me to my limits in some sense, made me really prioritize
Sure.
what I need to be doing, and really adding my mental health as a priority there, and making sure that I'm checking with myself, taking that time every day I like to run, so I add a
Mm-hmm.
run in every day. And I think that it's just been very helpful in a sense where I can kind of take a step back from everything going on and
Mm-hmm.
still have that sense of like routine.
Sure. Yeah.
Um, so yeah, I think that's been the biggest challenge, is just trying to adapt. As a student, you get so
Sure.
used to the same schedule.
Mm-hmm.
I mean, I've been in school for the last 24 years of my life, so
Right.
you get so used to the schedule, and
Yeah.
now it's kind of uprooted in a way that was really unpredictable.
Sure. Yeah.
So trying to adapt to that new normalcy.
Right. I think you almost have a leg up on everybody else being in a psychiatry background.
Yeah,
So, uh, thinking about mental wellness, mental health, and anxiety reduction, like those are things you've read the literature,
yeah,
and you kind of know the strategy. It goes hand in hand, right? So
yeah,
my background and expertise is more in like physical activity and fitness and behavior change. So I have a little kind of leg up there just to make it. Um, Relatable. Yeah, there's the topic. It kind of relates to your last point there that some other faculty members in just different meetings has been often discussed is what does the transition look like? So you talked about your routine, so we had to adjust there. Now we're adapting. Now we're used to working from home, but
hmm
eventually this in sometime in the near future, hopefully this social distancing will end. So what does the transition back to a different schedule look like? So we have pre-pandemic schedule,
hmm
pandemic, figuring it out. Now we're kind of all in a groove. We figured out how to, get Zoom to work and all these things. So what
right,
does it look like later on? And that could be another kind of, a significant environmental event that, could
right,
create some friction, so to speak, and produce some more, anxiety. Now we're re-entering, right, that
right,
the real world back again. So it's
yeah.
anticipate challenges there. So is there any, through this whole process of adapting, and I know there's been a lot of great supports from public health, is there anything that that maybe now a month in, that maybe some type of resource or support that maybe you kind of had in place early on, or anything at all?
Um,
I'm not trying to dig or pry or anything. It's just
no, you're okay.
it's just if there's something that you've learned through the process that, oh, I wish I would have known that or had that 6 weeks ago, that would have helped me get a little bit farther, that maybe somebody else could
Yeah.
use that idea.
Really, I've been Really just leaning on the support systems that I already had in place. But I
Mm-hmm.
feel like same thing. We've all just tried to be there for each other more during this
Right.
time, do daily check-ins.
Yeah.
What I think is kind of cool about this time is so I'm from Chicago,
Oh,
and
okay, great.
I moved to Florida for graduate school.
I'm from Indiana myself, so
Oh,
I'm
okay.
very familiar.
Yes. So my family's all still in Chicago, but interestingly enough, we've probably faced time more during the pandemic than we did beforehand.
Mm-hmm.
And I think it's just adding in that both the
Right.
anxiety and just the added time in your life and kind
Right.
of just the concern for others that wasn't necessarily always in the back of your mind before, that really pushes you to reconnect and be more active in reaching out to people. And
Mm-hmm.
um, I don't know, the phone goes both ways. So when I call my
Sure.
parents more often, they call me more often, and
Right.
same for
Right.
friends. So
Mm-hmm.
I think that's been helpful, is just being more present in
Sure.
relationships.
Yeah. No, I think that's great.
Yeah.
Um, well, Sarah, thank you for kind of sharing your insights and your work. I think
Yeah.
it's incredibly important. So, good luck with the rest of the semester with whatever we have left, and we'll talk soon.
Thank you so much.